basically every treatment that mainstream medicine does, there's a better alternative for. And by better I mean, if you think about every treatment they recommend, it's after you get sick. They never recommend anything to keep you from getting sick. Doesn't that seem strange? Right? One of the best examples of that is the stress test. The stress test is used to identify people or to find people so they can do bypass surgery on, or angioplasty. They want to look for people that have reached a point where they qualify for that surgery. Another example is telling women every year get a mammogram. Mammograms don't prevent breast cancer, although they seem to say that it does, right? They leave out the part. They say mammograms prevent or lower the risk of dying from breast cancer, but that's also been shown not to be true. And mammograms are just looking for women they can operate on. They use a PSA and men for the same thing. You know, oh, the PSA went up a little bit, let's stick a needle in the prostate so we can find someone to treat. And we can go to more common things like checking your blood pressure. Oh, it's high, now let's give you some drugs to lower it. Well, your cholesterol is high, let's give you some drugs to lower it. Do they ever tell you what you did wrong to allow those things to occur so that you don't have to even become a candidate for a drug? They never do that. So back around, let's see, I came down to Florida in 1981, and it was probably around 1990. Now, have you all been in Florida, at least back in the 80s, say?
Yeah.
Somebody, right? Do you remember Dr. Dan Reen? Used to be on the radio?
Yes.
You remember him? Good. And I remember him too, because I used to talk about chelation therapy. And when I came down here, I had just finished my residency in internal medicine, and I had never heard of chelation therapy except in the context of treating lead poisoning. Other than that, you know, they didn't use chelation for anything. And here he's saying chelation therapy is helping all these people with circulation problems. They would have heart problems, they would have leg circulation problems, and they were getting better. And I said, how can that be? And he would interview his patients on the radio show that he would do. So I went to one of his seminars that he would give in his office on chelation, and he introduced a book that was written by Dr. Elmer Cranton, MD, called Bypassing Bypass. And Dr. Cranton was a Harvard Medical School graduate. I figured that's coming from a good place, and he was explaining exactly why chelation therapy is helpful. So once mainstream medicine gets caught in a disinformation, let's say, then you begin to doubt almost everything along the line of what they tell you, because you begin to wonder what's their real purpose. Is it trying to keep people healthy or help people get well, or is it really just self-serving as far as, you know, selling drugs primarily? Not that long after that, I had a friend down here, and he told me, he was older than I am, and really into health, and he said, they're not trying to cure cancer. And I said, what do you mean they're not trying to cure cancer? And then I read The Cancer Industry by Dr. Ralph Moss. I don't know if you've heard of Dr. Moss, or his book, The Cancer Industry, and he spells it out also. Anytime they would come across a treatment that looks like it's going to be effective in dealing with cancer, somehow it disappears. You know, so we have all these treatments for cancer provided by mainstream medicine these days, yet the incidence of cancer hasn't gone down, nor has the death rate from cancer gone down. And some studies, and this was an Australian study, which was done to answer the question, just how effective is chemotherapy? And it said it might improve the patient's expectation of cure by as much as 2%. So you know, there's a lot of disinformation. And then there were studies done, they asked the question to the oncologists, if they had cancer, would they take their own treatment? And the majority said no. So it's really it's a shame that this is what we have to do with. And now the insurance companies, you know, you would think that the insurance companies and the pharmaceutical companies were working hand in hand, because it seems that's all they want to pay for is the mainstream medicine or Western medicine's approach, and they ignore any other approach. In fact, they ignore the requests of their clients. You know, you buy the insurance, but then they tell you what it's good for and what it's not good for. And that's, you know, my opinion is not right. Now, this is the website that I put together, which can tell you about many of the things we do. But the main two categories I want you to look at are the functional medicine ones. Because, you know, the bioidentical hormones. Breast thermography is a great category. Are you all familiar with breast thermography?
Sure.
Yeah, because mammograms are a worthless test. I mentioned that earlier. And I based that on several of the studies that were done. One in particular was published in the New England Journal about 3 years ago, and it said, they want to answer the question, if after doing 30 years of screening mammography, has it reduced the death rate in the women getting screened? And they compared, and then they said, looking back at prior studies, there are over 600,000 women involved, so you had 300,000 women getting yearly mammograms, another 300,000 no mammograms. And they just followed them for over 10 years to see what happened, and the death rate from breast cancer was the same in both groups. So screening mammograms didn't do anything except make business for the surgeons and the oncologists. So when I look at things like that, I say, you know, why aren't we doing anything? Forget about, you know, more, but anything to identify the underlying causes of these problems so we can do something to prevent them from occurring. Now, just want to touch base on this cell well-being. And I like this video because it really sums up what everybody has to be aware of in order to stay as healthy as possible.
Why should I get a hair scan? Do you wake up feeling tired, have frequent headaches or memory lapses? Do you just not feel as young as you should be? Could the pollution from the environment be having an impact on your well-being? Could your diet not be sustaining you and leaving you with a lack of energy? Almost everybody these days is living with a condition they would prefer not to have, and the potential of heart disease, obesity, diabetes and cancer is becoming far more common. The changes to our food and diet, increasing environmental pollutions and stressful lifestyles can lead to a poor expression of wellness. Most of us are living way below our optimal levels of physical, mental and emotional capabilities. Your hair can provide information on important questions speedily and effectively within just 15 minutes. The Cell Wellbeing S-Drive can instantly generate a full report digitally from our information center based in Germany, looking at issues such as toxins, nutrients, vitamins, minerals and amino acids, immune factors and foods and additives to avoid. A single strand of hair has been proven to be one of the most effective biomarkers, as it accumulates information about a variety of processes in your entire body. Leading scientists have long known that the key to looking younger and living longer is largely controlled by the environment that we create for ourselves. 98% of our physical expression is a direct result of our environment, with only 2% directly attributed to our genes. Modern-day stress and pollutions require a modern-day solution. What toxins could be challenging you? Could they be EMF frequencies, chemicals, radiation, or even parasites? tests do not guess. What could you be eating that is causing a challenge? What nutritional supplements are you lacking? With the awareness and information presented from a single hair test, indicating areas that need attention on your own personal optimization plan. Current conditions could be improved and future conditions could be avoided. Take a hair test today and follow the report indicators, using a step-by-step natural approach to optimize you. A sense of well-being is your own personal choice. Why not get a hair test today?
That with the information you get when you see a physician, he does a blood test. The blood test he's doing are used to serve just a couple of purposes, to see what drugs it can put you on, to correct an abnormal value, or to see if you're sick enough to be put in a hospital. And if he doesn't find anything wrong with the blood test, then he probably gives you an antidepressant, because he said you must be depressed if you're not feeling good. Instead of looking for all the potential possibilities that can affect how you feel. One of the areas that we've been talking a lot about on the radio are infections. I don't know if you've been noticing that, how it seems infections in our body are playing a role in how we feel or our inability to get better. Infections have been associated with cancer, heart disease, high blood pressure, diabetes, and every day there's more and more associations being made. And the other day, I spoke about a bacteria that I had never heard of before, but it came up in the, I suspect you'd never heard of this one either, melioidosis. And the reason I spoke about it was not to get anybody alarmed about this particular bacteria, because it's really not found in this country. It's found in Southeast Asia and Northern Australia. But it was just showing what bacteria are capable of doing. If you see this sentence, it says, patients with latent melioidosis, in other words, they've got it in your body, but it's not causing any problems, may be symptom-free for decades. The longest period between presumed exposure and clinical presentation was 62 years. So the point is, we all harbor lots of infections in our body, and our immune system hopefully is controlling them. A lot of times, though, maybe people are experiencing chronic fatigue. You could have an infection that's behind that, but mainstream medicine doesn't really recognize that as a possibility. The people that are at greater risk of any infection, and they pointed out here, are people with underlying health issues. They point to diabetes, thalassemia, alcohol use, renal disease. All these things weaken your immune system. We can name a few other things, like not getting enough sleep, or stress weakens your immune system, or taking a vaccination or flu shot. That stresses the immune system. So if your immune system has everything under control, and then you put that added stress from a vaccine, that may be the straw that breaks the camel's back. And that was illustrated by a girl they reported on who was 14, in perfectly good health, because they wouldn't give a vaccine to anybody that had any signs of an illness or infection. And of course, in that age group, the vaccine they want to give is the Gardasil vaccine against the human papillomavirus. So after she got the vaccine, she got very sick. Didn't happen the next day, probably happened a couple weeks later. So right away they said, well, it couldn't be the vaccine, because they expect everything to happen right away. So, fingers were getting pointed in every direction, and finally they determined that she had a lot of infections in her body that her immune system was controlling. So she had no symptoms, but the vaccine was what weakened the immune system enough to allow these infections to come out, and they found tick-borne illness in her, like Lyme disease. And at the time of the report, and it was a year after the vaccine, she still wasn't feeling that good. Now, another report that came up, I don't know if you heard me talk about Chris Christopherson. So, this was a kind of an interesting one, because it came out around the same week that another report came out stating that Alzheimer's disease was really caused by an infection. Now, we know that doctors aren't looking for infections in patients with Alzheimer's disease, but so here's what one of the reports that came out. So he had been diagnosed with Alzheimer's disease based on the fact that he was losing his memory. So you can see here it says battling memory loss for several years, but then one of the doctors he was seeing suggested that he get tested for Lyme disease. And he tested positive, and when they started treating him for Lyme disease, his memory started returning. I just wonder how many patients out there have been diagnosed with Alzheimer's disease when they really have a treatable problem that has not been looked at. They're still getting, by the way, mainstream medicine has treatments for everything. But you have to ask your doctor when he recommends a treatment, is it an effective treatment? You know, they have a lot of treatments, but they're not effective, but they treat you anyway. The report about Alzheimer's disease so this is in the New York Times, and I'm doing this in front of you so that you can Google it yourself and just, you know, do your own research, and it won't take much to become more knowledgeable than your physicians. But I doubt they ever look into these things. So what they found in this report was that the beta amyloid plaque that you always hear spoken about in the context of Alzheimer's disease, because when they do the autopsies, that's what they see in the brains, and they didn't know where it came from. They're saying now that's the body's response to fighting infections that have penetrated the blood-brain barrier, and the body is now fighting it off. And if you get too much of this beta amyloid plaque, it's going to affect the function of the brain and memory. So that's what they came up with. It was from Harvard. It was published in the Journal of Science, Translational Medicine, and that's what they're finding. So it says here, a virus, a fungus, or bacterium gets into the brain, passing through a membrane, the blood-brain barrier, and that barrier becomes leaky as people age. The brain's defense system rushes in to stop. So that's what what they're talking about there. But they won't talk about it because they don't have a drug to address this. They have drugs like Namenda, it's supposed to help your memory, but it really doesn't. They say it'll slow the progression of the disease down. And I always wonder, the question I mentioned to patients to ask their physician, how can I have faith that you're going to be able to cure my disease if you didn't know how to prevent it in the first place? I mean, it doesn't make any sense. You mean to tell me you can cure me, but you couldn't prevent it? I don't know, just, explain that to me. So, one of the areas that we need to be aware of is the infections. So I want to play this video for you. And this is about ultraviolet blood irradiation. Give you a little background on that. And, I did, when I was speaking of chelation, by the way, that was mainstream medicine. They used it back in the 40s and 50s. And like a lot of these effective treatments, they discarded it when they found a better way to make money, not a better way to help patients. So when the heart lung bypass machine became available, they said, oh, we can go in and do open heart surgery now. You don't have to use chelation, although it was effective. So back in the 1920s through the 1940s, ultraviolet blood therapy was used by mainstream medicine. So here's a little background on that.
Bacteria, which cause some of our most common illnesses, are single-cell organisms. There are 7 major categories or groups of bacteria, which are divided by shape and cell wall. When looking inside a bacterium, the simplicity of the cell is evident. The cell contains DNA, ribosome, and other basic proteins, and this simplicity increases susceptibility to UV light. UV-induced DNA damage can affect how proteins and enzymes are produced, having lethal effects. The UV LRX treatment begins with the insertion of a standard 20-gauge IV catheter. Next, the DLA is slowly integrated into the catheter. Both the DLA and catheter are firmly secured with a Tegaderm dressing. Quick calibration is performed to ensure precise delivery of therapeutic light. After calibration is complete, the patient cable is attached. The IV tubing and patient cable are neatly secured with standard medical tape. The first half of the 60-minute treatment emits both UVA and red light simultaneously. The second half of the treatment administers red and green light at the same time. The unique design of the UV-LRX system allows for an easy and non-disruptive treatment protocol. A healthy circulatory system is understandably vital for overall tissue health, and green light stimulation has been shown in studies to help the circulatory system. Green light irradiation has been shown to improve the elastic properties of red blood cells. In a disease state or the result of aging, the potential therapeutic ability of green light irradiation may help restore proper red blood cell function. With improved red blood cell function, gas exchange may improve, and in turn both cell and tissue function may improve. Light therapy may hold potential therapeutic benefits, and exploring these potentials is a priority of UV-LRX therapeutics.
So the original machine was called the knot machine, and like I said, it was used in hospitals for many years, and it's used around the world, and this new device is being used around the world as well, for a couple of reasons. One is very effective, but equally as important is the fact that the indiscriminate use of antibiotics is dangerous. It's dangerous to the person taking it, but also it creates all those superbugs that become immune to the effects of the antibiotics. Antibiotics are being overutilized. So now, I don't recommend this for everybody, but the people that I do recommend it for, people that don't feel good and you can't find any explanation for why they don't feel good. So at that point, my explanation is you're probably harboring subclinical infections in your body, but they're really not subclinical because they're giving you symptoms. They're subclinical because the blood tests don't show anything. You don't see an elevated white count, you don't have a fever. So then the doctors, if you don't have a fever or elevated white count, the doctor says you can't have an infection. But you could. And that's why I've been talking about infections all along, because when you test people, you see that they have infections. You can test for the presence specifically of infections, which I've started doing routinely in people that feel well. And what you're seeing is the presence of all these infections. Epstein-Barr virus, cytomegalovirus. And by the way, those two are all in the herpes family. There are about 8 different herpes viral infections that have been identified. So you find that, and you're finding antibodies which indicate prior exposure to these infections. And if you have continued elevated antibodies, it means the body is harboring these infections. A good example is shingles. That's getting a lot of publicity because they want to sell vaccines against shingles. The shingles vaccine is actually just a more powerful version of the chickenpox vaccine. And but that's an example of a virus that lies dormant in your body until there's a weakness in the immune system that allows it to become active again. So there are a lot of viruses that we harbor, and they can become active and they present in different ways. So that was the point I wanted to make. I'll let you listen to, these are people that had ultraviolet light treatments, and it benefits people in all different ways.
So I call the number on the bottom of the pamphlet and have had 4 treatments and am enjoying a much better quality of life.
I took this technology when I took OS hip.
So I want you to think about it. So if the ultraviolet light or the UVLRX treatment does 2 things, it kills off infections and improves circulation, the fact that all these people are feeling better with that treatment must be because they were harboring infections in their body that they were able to get better control of with the treatment.
About a year and a half ago, and I encountered a patient there who appeared to be suffering from an acute rabies infection. There was no medicines currently at the missionary hospital that could help him, and I offered to treat him with biophotonic therapy. And after 3 treatments, he had a miraculous recovery and was discharged from the hospital later that week.
Early January, I couldn't walk more than about 100 feet without being completely out of breath. I was just about to get a handicap sticker for my car, and I got the first treatment here. And lo and behold, I had tremendous energy. I could start to walk.
I came in and received a UBI, and that night I was laying in bed and the side of my face just started really tingling and the pain went away. And after that I had no more pain with the shingles, and it healed up within, I would say, 3-4 days.
I had an awful pain in my legs. When I walked, I couldn't hardly make it. I was with my friend and I said, this is like a miracle. I can walk 3 miles and I don't even have to stop. And my daughter said, Mom, you're really looking good these days. She said, your eyes are so blue and I can do all the things that I've always wanted to do without pain.
And then just one time and then I was just gone. To me it was like a miracle, you know, especially in my face and stuff.
I feel great. I feel very confident that my cancer is healing. Basically, I would recommend this therapy for anyone who has cancer of any type. There are no ill side effects.
So I called the number on the bottom of.
So that's UVLRX. It distinguishes itself because it's addressing the underlying cause of why people feel bad. This is going after infections. Chelation therapy goes after the accumulations of toxins in the body, specifically lead, arsenic, cadmium, and mercury. They're all poisons. And they don't say there's a safe level in the body. They say there's an expected level because we live in a poisoned environment, so we're all accumulating these